So what you are looking over here, this is a normal RBC histogram. Now if you see on the y-axis, the number of counts or the event is there on the y-axis, that is the frequency or the count is there on the y-axis, whereas on the x-axis you are having the size or the cell volume. So this is the normal RBC histogram. If you see, if you look at this curve, okay, this normal red cell distribution curve, it is a bell-shaped Gaussian symmetric curve. All these 3 points has to be used. A normal RBC histogram is a Gaussian bell-shaped symmetrical curve, as we can appreciate. The normal peak of the curve, this is the peak of the curve. The normal peak of the curve should fall within the normal MCV range of 80 to 100 femtoliter. The analyzer will count the cells between 36 to 360 femtoliter as RBCs. And you can derive two parameters from here. The first parameter is the MCV. The second parameter is the RDW. Both of them, they can be derived directly from the RBC histogram. Myself, Dr. Jibran Ahmed, presents to you Simply Pathology, and today we are back with a very important lecture. Today we are going to read about automated hematology analyzers. Now this topic is a very basic topic and it is very important not only for the first year residents, okay, but it is also very important for the third year residents or who are exam going. Why? Because a lot of questions are asked from this section and this is something that you have to know, or it is a must to know topic. So let us start the part 1 of automated hematology analyzer without wasting any time. So you know that the automated hematology analyzer, as you can appreciate over here, it has replaced most of the manual methods of calculating the CBCs. Okay, it is actually a baseline or it is a primary test in any small hematology lab. Okay, now it is quite rapid, it is very reliable, cost effective, accurate and precise. Now this automated hematology analyzer, it can either be semi-automated or fully automated. So what is a semi-automated device? So it is a device or analyzer where sample handling like dilution is required, and over here only small number of variables can be evaluated simultaneously, whereas in fully automated machines sample handling is not required and larger number of variables can be evaluated. So this is one way of classifying the automated hematology analyzers. Another part is whether they are a 3-part machine or they are a 5-part machine. Okay, so 3-part machine is that kind of hematology analyzer which can which can differentiate the WBC into 3 types, okay, as either neutrophil or a mix or lymphocyte. So the mixed variety comprises of monocytes, eosinophils and basophils. So the 3-part automated hematology analyzers, they cannot differentiate between monocytes, eosinophils and basophils. So that is why, because they are only giving these 3 data, that is neutrophil, mix and lymphocyte, so they are called as 3-part automated analyzer. Whereas the 5-part automated hematology analyzers can differentiate between the different types of WBCs like the neutrophils, monocytes, eosinophils, basophils and lymphocytes. So they can give a differential count of all these 5 cells. So that is why they are called as 5-part automated hematology analyzers. Now in the newer hematology analyzers and in the latest equipments, they are also having certain provisions for calculation of the reticulocytes as well as the blast as well as the atypical lymphocytes. So such machines, they are called as 7-part machines. Okay, so they are called as 7-part automated hematology analyzers. But in general, at least you should understand that there is 3-part and 5-part. Now I am going to show you a CBC report that is generated by basically the automated hematology analyzer. Now if you see, this is the basic CBC report. Now this is the 3-part. This is the one which is generated by 3-part automated hematology analyzer, and this is the one which is generated by 5-part automated hematology analyzers. Now why am I saying 3-part? So if you come over here if you see, there are only the differential count is only based on these 3 parameters. If you see, only the lymphocyte, granulocyte and there is a mid. So the lymphocyte percentage is approximately 18%, granulocyte percentage is 77%, whereas there is some amount of mix also which is comprising monocytes, eosinophils and basically your basophils. So over here if you can appreciate, the mid or the mix is not very high. So you need not see the particular slide, but if the mid is high, then you have to confirm or you have to calculate the individual cells in the mid variety by looking at the peripheral blood smear. Okay, so this is the CBC data that you can appreciate over here. Now if you see, along with this automated CBC report that you are looking at, you also have what is known as a histogram. So there is a WBC histogram, there is an RBC histogram, okay, there is a platelet histogram. So what is a histogram? Okay, it is nothing but it is a frequency distribution curve, as we can appreciate over here, and more in details will be discussed in the later half of the lecture. So right now you just understand that what a CBC or automated hematology analyzer report looks like. So in the three part, you will just have the differential count. If you see in the three part, will just comprise these three entities. Okay, so the differential count will contain lymphocyte percentage, granulocyte percentage, and a mix percentage. Whereas in the 5-part machine, if you see, you are not only having the neutrophil and the lymphocyte, but you also have separate differential count for monocytes, eosinophils, and basophils. That is why they are called as 5-part automated hematology analyzer. So you can appreciate over here these 5 sections over here. Okay, so now let us look what are the basic parameters that we are seeing in a basic report generated by an automated hematology analyzer. So as we can appreciate, the total WBC count is there, then we are having the differential leukocyte count, as we can appreciate over here, then their respective absolute counts are also there. Along with that, we are having RBC parameters like the RBC count, hemoglobin, hematocrit, the RBC indices including MCV, MCH, MCHC, and the red cell distribution width. Then among the platelets, we are having the platelet count, and in some better machines we are also having the mean platelet volume or platelet distribution width, or even the immature platelet fraction can be seen. Now over here, just like the 3-part machine, the 5-part is also showing a WBC histogram, RBC histogram, as well as a platelet histogram. In addition to that, what we can appreciate over here, that there is a scatter plot. Okay, there is a scatter plot. Okay, so basically a histogram and a scatter plot, they are basically some methods of data representation, and I will show you how to interpret such histograms and scatter plot. Okay, just stay tuned till the end of the lecture. Now, what are the components of a CBC? I have already enumerated and I am repeating once again. So they are having the complete RBC count, hemoglobin, hematocrit, RBC indices, that is the MCV, MCH, MCHC, and the red cell distribution width. Then we are having the WBC count, that is the total WBC count, and differential WBC count. Now basically there will be 2 types. You can see there is a 3-part and there is a 5-part. Okay, so basically in the 3-part we are having the neutrophils, lymphocytes, and mix, whereas in the 5-part we are having all the 5 differentials. Then we see the platelet count, mean platelet volume, platelet distribution width. Then the histograms of RBCs, WBCs, and platelets are also seen. The histograms are generated in both 3-part as well as your 5-part machines. Both of them will generate the histograms, as we can appreciate over here. Histograms are here also, histograms are here also. Okay, whereas there can be a scatter plot or scatterogram of the WBCs. This is nothing but this is indicative of the differential leukocyte count, showing the percentages of all the 5 types of WBCs. Okay, all 5 types of WBCs. Okay, so very important, the scatter plots are mainly there in the 5-part. So this is the scatter plot. You will only see such scatter plots in a 5-part automated analyzer or higher. Okay. Okay, so I hope you are having a basic idea that how a automated hematology analyzer report looks like, what a 3-part report looks like, what a 5-part looks like, what is the difference, what are the histograms, and what are the scatter plots. Okay, so you have a basic understanding that what all are the different components that you are coming across when you are looking at a automated CBC report. Okay. Next, we are going to see what are the applications of hematology analyzer. So very importantly, the most important for detection of anemia and polycythemia by looking at the hemoglobin percentage. Now, because we are also having MCV, that is the mean corpuscular volume. So if we are having data on that, it is going to help us in the morphological classification of anemia into either microcytic, normocytic, or macrocytic. So if MCV is less than 80 femtoliter, it is microcytic anemia. Between 80 to 100, it is normocytic anemia, and if it is more than 100, it is macrocytic anemia. Then it is also helping, now remember, this automated analyzer is also helping us to differentiate between iron deficiency anemia and thalassemia minor. How? Very, very important to understand. If you see an iron deficiency anemia, there is a decreased RBC count and increased red cell distribution width. Whereas if you see in thalassemia minor, the RBC count is either normal or only slightly increased, okay, and if you see that the RDW is near normal. So the RBC count, they are increased or they are normal, but they are never decreased in thalassemia minor. One another thing is, in iron deficiency anemia, you have associated thrombocytosis as well, okay. So this is how your machine is helping you in differentiating between iron deficiency anemia and thalassemia minor. Again, it is useful for detection of thrombocytopenia and thrombocytosis, and not only thrombocytopenia, some machines are also helping us to know the probable cause of thrombocytopenia, and for that we need the mean platelet volume. So the mean platelet volume is helping us to differentiate the cause of thrombocytopenia, whether thrombocytopenia is because of increased peripheral destruction of the platelet versus because of reduced production of the platelets, and that can be understood from the mean platelet volume. All these parameters will be discussed in details in the respective section, okay, so don't worry about that. Okay, then we will see the detection of the WBC disorders. Okay, so it is also useful for detection of the WBC disorders. So any kind of cytopenias, for example neutropenia or neutrophilia, you can understand by looking at the reports. Okay, then leukemias, for detection of leukemias. Now diagnosis of leukemias, okay, they are done along with examination of the PBS. You can diagnose the different kinds of leukemias, okay. So for detection of WBC disorders, again it is very important. Now how does a automated machine count help us in diagnosis of leukemia? The count will become very high, the platelet count will become very less. There will be, you know, reduced platelet count or increased WBC count is there that even the machine cannot read, okay, that is out of the range of the analyzers, okay. So from the machine report you can suspect, and then it will be confirmed on the peripheral blood smear, okay. Also this automated machines, they are used for screening of thalassemia minors, and not only that, certain newer parameters are also introduced which are helping in further refinement of diagnosis. For example, a new parameter, that is reticulocyte hemoglobin content, helps in early detection of iron deficiency anemia. Similarly, hemolytic anemia with cystocytes, okay, they can be detected by certain machines, and basically detection of such cystocytes is basically indicative of microangiopathic hemolytic anemias like TTP, HUS, DIC. Okay, then certain new parameters are recorded by certain automated analyzers such as immature reticulocyte fraction and immature platelet fraction, okay. So such parameters are basically used for, you know, because they are acting as an indicator of successful engraftment of hematopoietic stem cell transplant. So again, these are certain new parameters, and certain automated analyzers can also detect the presence of malarial parasites. So these are some of the newer parameters which are incorporated in some of the latest hematology analyzers, okay. Not only that, they also help us in the correlation of the numerical data with the histograms, okay. So we can see whatever numerical data that we are getting, okay, they should, you know, they should correlate with the histogram, and how the correlation is is to be done, we will teach you, okay, after the basics, okay. So right now we have just read about the basics of your hematology analyzer, and we have read about the applications of the hematology analyzer. Now we are going to understand a very important thing in relation to the hematology analyzer, that is the principles of working of hematology analyzer, and this can be asked as a long answer question, and it is a favorite question of the examiners, okay. So very important, automated analyzers, they are working on a combination of different principles. So what are those principles? Let us see. We are having electrical impedance or Coulter principle, optical light scatter, fluorescence, VCS technology, that is the volume, conductivity and scatter technology, cytochemistry and immunological methods. Now out of all these, the first two are the most commonly utilized, you know, methods, okay, in the different automated hematology analyzers. But in some of the better and modern hematology analyzers, they are incorporating all these as well. Okay, so let us begin today's topic of discussion, that is the principles of working of hematology analyzer. So first and foremost, we are going to discuss about the electrical impedance or the Coulter principle. So what is the electrical impedance or the Coulter principle? Now to understand this thing, you have to understand one important thing over here, that what are some of the important components that we are looking over here. So first, what you can appreciate, you can see that there is a diluent chamber, okay, which is itself comprising of an external chamber. This is the external chamber, and an internal chamber. This is the internal chamber. Both these chambers, okay, both these chambers are separated from each other by means of an aperture. So this is the aperture that we can appreciate over here. So over here we are having the aperture, okay. So there is an aperture which is separating the two chambers, okay. After that, if you see, this particular chamber is filled with a buffered electrolyte solution, okay. It is an electrically conductive diluent, okay, which is going to allow electric current to pass through it, okay. So it is an electrically conductive diluent, okay, that is the buffered electrolyte solution, okay, that is there in this diluent chamber. And in this buffered electrolyte solution, we are going to introduce the blood cells. So blood cells will be suspended in this buffered electrolyte solution. Now what is very important, you will see that in the external, okay, and in the internal chambers, there is an external electrode, okay, the external electrode, this is the external electrode, and there is an internal electrode, as we can appreciate, this is the internal electrode, okay. So basically we can see that in the outer chamber an external electrode, and in the inner chamber an internal electrode is placed, okay. And what happens over here, that we are applying constant low power direct current is applied between these two electrodes. So what is the setup over here? The setup is very simple. We are having a diluent chamber comprising of an outer and inner chamber, as we can appreciate over here, okay. So there is an outer and inner chamber which are separated by an aperture. Now this diluent chamber is containing a buffered electrolyte solution in which the blood cells are suspended. And if you see, basically we are introducing two electrodes, one external and internal, in the two diluent chambers, okay. Now what we are doing, we are now passing low voltage DC current is now constantly applied between the two electrodes. Now as this is basically, as this electric current is applied, what is happening, that the blood cell, okay, the blood cell, you can see these are the blood cells. So these blood cells are going to pass through this aperture, okay. So the blood cells are going to pass through this aperture. So when the blood cell passes through this aperture, it is going to displace a volume of diluent, thus increasing the resistance, okay. And this leads to a change in the potential between the two electrodes, thus generating a voltage pulse, thus generating what is called as a voltage pulse. Now the height of this pulse, the height of this voltage pulse that is generated, okay, by the passage of the blood cell, okay, that is directly proportional to the cell volume or the cell size, and this is allowing the differentiation of the cells according to the size. For example, platelets are having a different size, RBCs are having a different size, WBCs are having a different size. So they are allowing for differentiation of the cells based on their size. So the height of the pulse is directly proportional to the cell volume or the size, thus allowing differentiation of cells according to their size. Now the second thing that happens when a voltage pulse is created, so the number of such pulses created is indicating the cell count. So for example, the number of platelets which are generating the pulse is going to indicate the platelet count, okay. So very importantly, whatever voltage pulse is generated because of the passage of the blood cell across the aperture will have a height and basically will have a number, okay. So very importantly, the height of the pulse is directly proportional to the cell volume, whereas the number of pulses generated is directly proportional to the cell count, okay. So whatever data that we are getting, the data that we get, it is plotted in the frequency distribution graph, for example in the form of a histogram or in the form of a scatter plot, okay, wherein the cell size, they are plotted on the x-axis and the cell number or the frequency is plotted on the y-axis, okay. I will show you how a histogram looks like and how the distribution is made. I will show you in details, okay. So don't worry about that. So what happens, that because of this impedance or Coulter principle, what is happening, that cell populations, okay, distinct or different cell populations are separated based on the size threshold set by the manufacturer, and cell count is done between the cell threshold. For example, there is the threshold, okay. For example, there is a lower threshold for counting the RBCs and there is a higher threshold for counting of RBCs. So any cell that is falling in between these two size threshold, that is between 36 and 360, will be counted as RBCs. Similarly, any cell which is between these two size threshold between 2 and 20. Now 2 is the low threshold for platelet and 20 is the high threshold for platelet. So any cell lying between 2 and 20 femtoliter will be calculated or counted as a platelet. Okay, so cell populations are separated based on the size threshold set by the manufacturer, and the cell count is done between the set size threshold to give a count of a particular population. Okay, so what are the variables which are measured with the help of this principle? That is the principle of electrical impedance or Coulter principle. This is a very important and the most important principle when it comes to automated hematology analyzer. This question will be asked in the exam. This is a very or the most important exam question, that is the electrical impedance or the Coulter principle. Okay, now what are the variables that you can measure with the Coulter principle? Most of the variables that you see in the automated analyzer can be measured, like among the RBC count, the RBC indices, that is the MCV, okay, the histogram as well as the RDW. Now remember, the RBC histogram only, from there only directly you can derive the MCV and the RDW, whereas the other parameters, they are derived from the equation, that is the hematocrit, MCH, MCHC. These are all indirectly derived parameters, that is the hematocrit, MCH, MCHC. Then among the WBC parameters, the WBC count and the differential. Okay, so impedance, remember the principle of impedance can only make a 3-part differential. They cannot help in 5-part differential, so you should keep that in mind. Okay, and very importantly, the WBC histograms can also be generated, okay, with the help of impedance. And the platelet, okay, among the platelet parameters, the platelet count and the platelet histogram, okay, can be generated, and from the histogram you can get the mean platelet volume and the platelet distribution width. Okay, so very important, all the different respective histograms and these parameters can be generated. Okay, remember 3-part differential can be generated only by this principle of electrical impedance. Okay, so I hope this point is crystal clear to everyone. Okay. Now the next important principle which is basically used in automated hematology analyzer is that of optical light scatter. Now very importantly, I have already spoken about this principle, okay, when I have taught you about flow cytometry. So if you want to learn in details about the principle of flow cytometry, please go and see my video on flow cytometry that has already been uploaded in my website as well as in YouTube. So basically, in this principle of optical light scatter, what you are requiring is, so you are giving the sample over here and you are creating a hydrodynamically focused beam of light. That means only single cells will pass, okay, at the point of interrogation. Okay, only a single file of cell will pass at the point of interrogation. That is called as hydrodynamically focused beam of light. So a sample is introduced and we are creating a hydrodynamically focused beam of light, and that beam of light is made to pass through a laser light source, which is nothing but the point of interrogation. So what happens, that basically laser light is going to touch a particular cell, and after that the laser light will become scattered. So there will be a light scatter at this point of interrogation. So there are different types of light scatter. Some of the light, they are going to go in line, okay, in line with the laser, that is the forward scatter. Some of them will go at 90 degrees, that is called as the side scatter. Okay, so the forward scatter is directly proportional to the cell size, whereas the side scatter, which is at 90 degrees to the laser beam, okay, they are giving information about the cell complexity as well as the granularity. Okay, so there is a forward scatter and there is a side scatter. Not only that, if the cells are labeled with a fluorescent dye, then when the laser light is falling on the cell containing the fluorescent dye, they are going to emit a light of a particular fluorescence. Okay, so even that can be, that can be measured. That is, fluorescence can also be measured provided you are tagging the cells with certain fluorescent dye. Okay, that principle is a little bit different. I will, that I am going to discuss later on. Okay, but right now you have to understand that whenever a laser beam is falling on a particular cell, they will have a forward scatter and they will have a side scatter. Forward scatter is a measure of the cell size, whereas the side scatter is a measure of the cell complexity and the granularity. Okay, now what is very important about the optical light scatter that we have to understand, that this technology is mainly useful in 5-part WBC differential as well as for making the reticulocyte count. So this technology is used when you want a 5-part differential, when you want that the WBC differential be in terms of neutrophils, monocytes, basophils, eosinophils and lymphocytes. You want the 5-part differential, because over here the site scatter is helping us to characterize those cells and to differentiate between them, because the site scatter is basically looking at the cell complexity and the granularity. So this is the second principle that play. Now the third important principle is that of fluorescence. It is very much similar. It is applying the principle of optical light scatter only, but over here the sample is basically tagged by a fluorescent dye. So fluorescent dye is added to the sample before introducing the cell sample into the hematology analyzer. Okay, and this dye is going to stain certain structures within the cell. As that cell will pass through the laser light, they will emit specific wavelengths of light depending on the fluorescent dye or the fluorochrome that is used. Okay, and depending on that information, this is the fluorescence as I was telling you over here. This is basically the fluorescence, and this fluorescence will be detected by multiple photo detectors, and then the signal will be converted into a digital one that is going to be represented in a scatter plot, okay, or in a graphical representation that will be there. So this is to highlight the different structures inside a particular cell. Now, for example, we will use propydium iodide. This is one kind of fluorescent dye that is basically it is going to highlight the NRBCs, or they are going to tag the NRBCs. So they are going to help in NRBC counting. Similarly, thiazole orange can be used for platelet count, immature platelet fraction, retic count, immature reticulocyte fraction. Okay, so this is the use of the principle of fluorescence. Okay, so they are basically present in very high end machines. Okay, then we have what is called as a VCS technology. Now usually the principle of impedance and optical light scatter is used by most of the present day machines, but some of the modern machines, okay, wherein they are present in very higher centers, or where they are used for research purpose, where you require very accurate data. In that case, there is a very powerful technology that is available, that is called as the VCS technology. It is the most powerful tool which is available for blood cell analyzers. It provides the greatest specificity, sensitivity and efficiency, and it provides the three-dimensional analysis of the cell, and it helps in characterizing the distinct cell clusters. Okay, so basically, as you know, VCS stands for volume, conductivity and scatter. So what is the principle of VCS? Let us try and understand. So first we will look at the volume. Okay, so basically the VCS technology utilizes the Coulter principle, that is the impedance only. The Coulter principle of impedance is utilized to measure the volume of that entire cell, the volume that the entire cell displaces. So this is a neutrophil over here, and we are applying the principle of impedance only to measure the cell volume or the cell size. Then also over here they are utilizing some other principle by which they are giving alternating current in radio frequency range is used to collect information about the internal structure of the cell. For example, what is the chemical composition or what is the nuclear volume. Okay, so the conductivity principle over here is basically applying alternating current in radio frequency range to collect information about the internal chemical composition as well as the nuclear volume. Okay, and we are also applying the principle of scatter over here. When a cell strikes a laser beam, okay, like we had seen in the optical scatter principle, then there is some scatter of light. Okay, so when a cell is striking a laser beam, the scattered light spreads in all direction. So the median angle light scatter is then collected, that is giving information about the cellular granularity, nuclear lobularity plus information about the cell surface structure. Okay, so this technology, that is the VCS technology, is making use of the principle of impedance or optical scatter as well as conductivity, okay, to get a lot of information, and this helps in very accurate differentiation of the cells into the different types. And not only that, they also help in detection of reticulocytes as well as detection of atypical lymphocytes as well as the detection of the blast cells. Okay, so they are very specific, sensitive and efficient machine, and they are very expensive machines, so they cannot be used for day-to-day practice, but yes, for research purpose or in specialized labs they are utilizing this VCS technology. Okay, now the other principle is that of cytochemistry. So the principle is based on that cytochemical reaction determines the peroxidase activity which is only present in the WBCs. It is never present in the lymphocytes. So the relative positivity which is seen in the neutrophils, eosinophils, monocytes along with light scatter data is used for differential leukocyte count. Okay, lymphocytes are not stained, okay, by the they are not stained by the cytochemical stains or the myeloperoxidase stains. Okay, so they are not going to come positive. So this is another principle, that is the principle of cytochemistry can be applied. And lastly, we are having the immunological based cell count, which is very useful for accurate platelet count. Okay, now over here we are using certain antibodies or we are using certain markers like CD41, CD61 antibodies are used to highlight the platelets. So they are very specific and you will get an accurate platelet count. Over here the most important thing is that the RBC fragments, they are not counted as platelet. Usually sometimes in the normal machines RBC fragments can be counted as platelets and you might get a higher platelet count, but over here they will not be counted as platelet and you will get a very accurate platelet count. So that is the use of a immunological based cell count. So here are the different kinds of principles that we have discussed. Okay, and in the last leg of today's topic, in the part 1 of automated hematology analyzer, we are going to discuss about the different RBC parameters that we are going to see. So before that, let us try and understand that what happens. So you have taken this sample, this is the whole blood that is introduced, okay, to the mixing chamber and they are diluted. So they have to be diluted. Okay, a diluent is added over here to the mixing chamber. Now what happens that there are different chambers. There is an RBC chamber, there is a WBC chamber. Now the cells in the intact form, they are introduced in the RBC chamber. Okay, and by applying the principle of impedance or the Coulter principle, all the RBC and the platelet parameters are calculated. Okay, so all these cells which are lying between the size of 2 to 20 femtoliter will be counted as platelets, whereas those lying between 36 to 360 femtoliter, they are going to be counted as RBC. Okay, so remember in the RBC chamber, intact cells are introduced in the RBC chamber. Then there is another chamber, that is the WBC chamber. In the WBC chamber, the sample or the cells has to be lysed, and the cells are lysed by using non-ionic detergent. Now why is it so? Let us try to understand. Okay, in the WBC chamber, first of all the cells are lysed, and once the cells are lysed, the hemoglobin will be released. So whatever hemoglobin is released, they can be measured spectrophotometrically. Okay, and then once the RBCs are lysed, okay, the cells are lysed meaning only the RBCs are lysed. Sorry, I just wanted to mention you over here, the RBCs are lysed. Okay, whereas the WBCs are intact. Okay, so in the WBC chamber you have to lyse the RBCs so that the hemoglobin comes out, and secondly because the RBC does not interfere with the WBC count. Okay, so over here the WBC is intact and they are counted by the impedance technology. So any cell which is more than 35 femtoliter, they are counted as the WBCs. And hemoglobin, it is estimated by cyan-meth hemoglobin method by using Drapkin's reagent, or you can use less hazardous non-cyanide reagent like sodium lauryl sulfate for calculation of the hemoglobin. Okay, now you must be thinking that, sir, over here for the counting of the RBCs, okay, we are not we are not lysing any cell. The RBCs and WBCs are intact and yet they are introduced in the RBC chamber. So sir, we are seeing that any cell more than 35 femtoliter, they are counted as WBCs, and over here also those cells are counted as RBCs. So the WBC might add up to the RBC count, right? But very importantly, you have to understand that the RBC count, it is in millions per cubic millimeter, whereas the WBC count, it is in thousands. Okay, so the WBC count is very less. Normally the WBC count is very less in comparison to the RBC count, and therefore they are not statistically significant and they do not alter the RBC count. Therefore, in case of RBC chamber, all the intact cells are introduced, okay, but vice versa is not true. In the WBC chamber, all the RBCs has to be lysed. Why? First of all, because the RBC count is much higher than the WBCs, and if the RBCs are not lysed, then they are going to falsely show a very high WBC count, number one. Number two, the hemoglobin, for hemoglobin estimation, the RBC has to be lysed and therefore the hemoglobin has to be released, and that hemoglobin is to be estimated spectrophotometrically. So you have to understand this principle very clearly, because this will be asked to you in the exam. So there are two chambers, RBC chamber which is going to measure RBC and platelet parameters, and there is the WBC chamber which is going to measure the hemoglobin and the WBC parameters. Okay, the principles are also stated. All the parameters are measured by Coulter principle or by the principle of impedance, except hemoglobin, which is measured by spectrophotometry. And remember, in the WBC chamber the RBC has to be lysed. Why it is so, I have given you the reason over here. Okay. Now we are going to see, now you have collected the information by the impedance. Okay. Now very importantly, data representation can occur by two forms. One is with the help of histogram. So we are having RBC, WBC and platelet histogram, and then we are having scatter plots. Now always remember, scatter plots are only available in the 5-part machines, whereas histograms are available in both 3-part as well as in the 5-part machines. Now we are going to see in this lecture, the last leg, we are going to look at the RBC parameters, whereas the WBC and the platelet parameters and the newer parameters along with the advantages, disadvantages and pitfalls of automated hematology analyzers will be discussed in the next lecture. So let us begin with the analysis of the RBC parameters. So the first parameter that we are looking over here is the hemoglobin. So we have already seen that non-ionic detergent is added for rapid lysis of the red cells so that hemoglobin is released. And this hemoglobin, okay, in the presence of potassium ferricyanide, okay, or the Drapkin's reagent will be converted into cyan-meth hemoglobin, which is going to be measured with the help of a spectrophotometer at an absorbance of 540 nanometer. Okay. Now this potassium ferricyanide is basically, there's the health hazard. So basically you might use non-cyanide reagent like sodium lauryl sulfate as well. In the newer machines they are using non-cyanide reagent. Okay. So this is how the hemoglobin is measured. Okay. Now you have to understand one important thing. If the WBC count is very high, or there is hyperlipidemia or hypergammaglobulinemia or cryoglobulinemia, all these conditions, they can falsely elevate the hemoglobin in the automated hematology analyzer. So you should keep in mind about these parameters. Okay. Then the second group of parameters that we are getting under the RBC group, they are the derived or the indirect parameters, which are not directly measured by the machine, but they are derived, okay, from the other parameters. Like what are those? So very important, the first important thing, that is the hematocrit. So hematocrit can be derived by this formula, MCV into RBC count divided by 10. Then we are having MCH, which is in picogram. So how do you derive the MCH? Hemoglobin divided by the RBCs into 10. Now remember, the mean corpuscular hemoglobin, it is giving a measure of both the RBC size as well as hemoglobin concentration. So whenever the MCH is low, it is pointing towards hypochromia or microcytosis or both. Whereas increased MCH, sometimes it is also indicative of macrocytosis. Remember, I am talking about MCH and not MCV right now. Okay. Another derived parameter is MCHC, that is in gram per deciliter, that is the hemoglobin divided by the hematocrit into 100. Okay. So this MCHC is basically a measure of increased density or increased viscosity or hyperchromia. So when the MCHC is high, it is indicative of increased density, viscosity and hyperchromia. It is the most important parameter which will alert the user about the possibility of a spurious or a wrong result, since it is derived from multiple parameters. So what are the conditions where you will see increased MCHC? So there are conditions in the plasma. So for example, if there are cold agglutinins or hyperlipidemia or hyperglobulinemia or hyperproteinemia, that is going to raise the MCHC. Similarly, in the red cells, extreme microspherocytosis, okay, or sickle cell disease, okay, both of them, they can increase the MCHC. Okay. So very important, the causes of increased MCHC. Okay. And what are its significance? Okay, the third important parameter that we are seeing, it is very important, that is the RBC histogram. So what you are looking over here, this is a normal RBC histogram. Now if you see on the y-axis, the number of counts or the event is there on the y-axis, that is the frequency or the count is there on the y-axis, whereas on the x-axis you are having the size or the cell volume. So this is the normal RBC histogram. if you look at this curve, okay, this normal red cell distribution curve, it is a bell-shaped Gaussian symmetric curve. All these 3 points has to be used. A normal RBC histogram is a Gaussian bell-shaped symmetrical curve, as we can appreciate. The normal peak of the curve, this is the peak of the curve. The normal peak of the curve should fall within the normal MCV range of 80 to 100 femtoliter. The analyzer will count the cells between 36 to 360 femtoliter as RBCs. And you can derive two parameters from here. The first parameter is the MCV. The second parameter is the RDW. Both of them, they can be derived directly from the RBC histogram. So MCV, it is the perpendicular line from the peak of the curve till the base. So this is the MCV. So this is the peak. So from here you can see a perpendicular line has been dropped and it is lying somewhat over here. So this is giving you the mean corpuscular volume. So mean corpuscular volume is the perpendicular line from the peak of the curve till the base. Okay, this is number one, that is the MCV. So how is MCV derived? You have to answer like this. Secondly, the red cell distribution width, it is determined by calculating the width of the RBC histogram. It is calculated by determining the width of the RBC histogram. So you can see this is your width, and this width is giving an idea about the red cell distribution width. Okay, so this is about the normal RBC histogram. Now let us see some of the abnormalities in the RBC histogram. So as you can appreciate over here, this is the normal RBC histogram. Sometimes there is a shift to the left. So a left shift is indicative of microcytosis. Okay,